Chilling night unfolded at the emergency department when a frantic man arrived carrying his wife Asma, who had just given birth at home but was now unresponsive and bleeding very profusely. The doctors quickly took over, but it was already too late. This was not just a typical birth story, it was a tragic tale of severe bleeding that turned fatal due to delayed medical care and misguided choices. Asma, a 35-year-old mother of four, had opted for a home birth for her fifth child, influenced by her husband, Sirajuddin, a self-styled Orthodox cleric who insisted on avoiding hospitals. Around 6 p.m. on Saturday, she delivered a baby boy in their rented home without medical supervision. Initially, everything seemed normal, but within hours, Asma began to suffer severe bleeding. Despite her deteriorating conditions, Sirajuddin does not seek immediate help. It was only after Asma was found unresponsive 3 hours after delivery that he called an ambulance. Asma's bleeding was a classical case of postpartum hemorrhage, a condition where a woman loses excessive blood after childbirth. Normally, the uterus contracts strongly after the delivery to compress blood vessels and stop bleeding. However, in postpartum hemorrhage, these contractions fail, or other complications like retained placental tissue or trauma that can cause uncontrolled bleeding. This can lead to a rapid loss of blood volume, causing hypovolemic shock, which is a dangerous condition when there is a drop in blood pressure that restricts blood flow to vital organs and can quickly become life-threatening. The causes of postpartum hemorrhage are often summarized by four T's. First one is decrease of tone, which is also known as uterine atony, where the uterus fails to contract properly. Uterine atony that accounts for about 70% of the cases, making it the most common culprit. Second one is trauma that causes the tear or rupture to the uterus. The third T is tissue, that is retained bits of placenta inside the uterus, which keeps on irritating the walls of the uterus and prevents its contraction. The last T is thrombin, that means if the mother has some kind of clotting disorders which can cause a severe bleeding during the delivery time. In Asma's case, the exact cause was not immediately clear, but the severe bleeding indicated a failure of uterus to contract properly after delivery. After Asma's death, Sirajuddin hired an ambulance late at night to take the body to her family for burial without informing the hospital people. Suspicious, the family alerted the police, who intervened and redirected the body to the hospital for post-mortem examination. The hospital confirmed the death and began an investigation into the circumstances that highlights the negligence and dangers of unsupervised home births, especially when warning signs are often ignored. Scientifically, postpartum hemorrhage can occur suddenly because the uterus, which during the pregnancy receives about 600 milliliters of blood per minute, must contract immediately after the birth to clamp down the open blood vessels where the placenta was attached. If the contractions are weak or absent, the blood flows freely, leading to rapid and massive blood loss. The body can lose over a liter of blood quickly, and the symptoms like dizziness, rapid heartbeat, and fainting may not appear until 25% of blood volume is lost. This delay in symptoms onset make early recognition challenging but critical. Research shows that postpartum hemorrhage remains the leading preventable cause of maternal deaths worldwide, accounting for up to 20% of maternal deaths in developing regions. Prompt hospital care, including uterine massage, medications to stimulate uterine contractions, and surgical interventions if necessary, can save lives. However, home births without skilled attendants and emergency backup significantly increase risk. This tragic story underscores the vital importance of hospital births, or at least a professional medical supervision during the delivery. While the desire for a natural or home birth is understandable, childbirths can be unpredictable and dangerous. Medical science has developed effective strategies to manage complications like postpartum hemorrhage, but only if care is timely and appropriate. In conclusion, Asma's death was a preventable tragedy that is caused by severe postpartum hemorrhage that was not promptly treated due to her husband's refusal to seek hospital care. The sudden onset of massive bleeding after the childbirth is a medical emergency that requires immediate intervention. The story is a sober reminder that childbirth, while natural, carries risk that demands respect and readiness to act with medical support. Thank you guys for listening. If you like this video, give it a thumbs up and share with all your friends. See you next time.